significant amount of learnings and discoveries, new discoveries. So Fabian, can we put the presentation up? One of the key challenges we have is, for example, if you look at our experience in occupational health and safety, we tend to find that many organizations fall into the trap of being compliant driven, and they don't look at the key aspects of, in terms of whether you already working under COVID or you actually going back to work. So in South Africa, you have basic level 3. If you're in India, you had some industries that were working as essential, very similar to South Africa, Qatar. And now you're starting to see these levels reduce in terms of the current status of the pandemic, and based on World Health Organization's directions to the various governments. A key component of this is we want to ensure a safe and healthy environment for the workers, for our customers, and for ourselves. If we own companies, if we are working in a company as a manager or a CEO, this should be our main drive in terms of providing a safe and healthy work area for all. Okay, and as I said earlier on, we tend to get caught up in the documentation side, and typically what happens is we lose focus on our key area, and that is our clients, our visitors, our employees. And I'd like to, this presentation is slightly different than what a lot of people are presenting on COVID. And it deals more with key areas in terms of strategy. It looks at the OHS directive by the ministry, by the Department of Labor in South Africa, and gives you a very high level overview of key areas that you should have in place. Next, please. The next slide, I won't go in depth as Fabian has mentioned me and gave an introduction. I'd just like to say that we've got over 30 years of experience. We've all dealt with various similar or pandemics in past. We haven't had it at this level where it's captured internationally, the international attention as it has when we look at COVID-19. But some of the elements we've actually around before in terms of pandemic screening, isolation, work. Next, please. Okay, so just the purpose of the presentation, and for those that are joining us that are not from South Africa, it's also important to link and see your government stance in terms of the COVID-19. Is there any legislation that's been pushed out? Do companies actually understand it? And how are they coming to grips with actually implementing? So this is what we'll be talking about this morning as well. We'd also look and reflect on a key question: our current readiness, your current readiness. I've been asking that from day one. What type of readiness do we have? And how are we conditioning ourselves in terms of our readiness? As I kick this presentation off, I said it's important to look at the worker, the customers, and the more important ourselves in terms of our health and safety. We'd also be looking at a strategic approach in addressing COVID-19. Then we'll just touch on the main occupational health and safety risks. And this we've also worked with the ILO, International Labour Organization, and looked at 3 of the most common occupational health and safety risks. You may be exposed to more, and we'd like to hear more from you on these. Next, Fabian. Okay, so a bit on the Occupational Health and Safety Directive. If you look at it, it's a risk-based approach. So for me, there's no major change because the vehicle of any organization is risk-based. And a lot of organizations that weren't working on risk-based approaches are feeling the challenge now more than ever to adjust. So when you're assembling your health and safety committee or your COVID strategic teams, you need to look at from your risk management structure, your systems, and what has changed and how have you actually put in mitigation measures. So work as one team within your organization, but start off, for me, this is key. You know, if you get someone, they've actually made a decision with 3 or 4 clients this week or last week come up and they're battling because a lot of staff actually fit into a category of impacted staff. So they're either for a certain age or they a decision to actually work remotely. Now, a risk-based approach, if you have this, that means you don't need to put in the various additional measures that are in the directive. Everyone's working from home. You look at ergonomics in the home, etc., which we'll cover later. The other area is medical screening and testing, which many of us have been discussing in length, and it is presenting some challenges. I know in India, one of the guys actually shared a photograph of, and I wish I had actually, put this on the screen, of a guy holding his hand, like what I'm doing now on my picture, to check the effectiveness of the body temperature. And the guys were actually making it a joke. But in actual fact, that's one of the best ways to actually test for temperature. And if you go back in our history, that's the way nurses and staff test temperatures, right? It sounds outdated, but with technical machinery, the machines that we're using today are also providing evidence that they don't work 100%. So I just wanted to share this in terms of medical screening and testing. In terms of testing also, what's the correct method of testing in your organizations? What systems have you got for testing? And especially in terms of the turnaround of your testing results, how have you adjusted for that? The directive also talks on a system review and update. So for example, from your health and safety policy, which every organization should have you adjusted it to fit in the COVID side in terms of the occupational health side? So my main concern is a lot of guys are going and redeveloping tons of documents on this. Look within your management system and provide the necessary updates based on your organization. Another key element here is the reporting process. So what are your reporting protocol in terms of occupational illnesses? Who's the focal point? Your your COIDA, compensation for occupational injuries and disease. Are you in good standing? Although all organizations should be in good standing, we have come across certain organizations that once they have a letter, they've landed a contract, they fall behind on payments, etc. So this is a key one in terms of not just your reporting process, but your letter of good standing. Also on reporting process, if somebody presents, for example, the symptoms, they put into isolation or self-quarantine, it's important to record it, but not report it. So this is a discussion that we've had for quite a while now. So what you're going to be doing is you're tracking your self-quarantine cases to your positive medical cases that are reportable, okay? And we can discuss more on this later on. Two other key areas for me on the directive are measuring. So when we looked at the directive, and we've had some lengthy discussions on this, you also need to track in terms of how effective your programs are in terms of COVID. So just like your occupational health and safety system, you have an audit system. You need to incorporate your COVID-19 programs into this. And lastly, a very important part of the directive focuses on communication. And it stresses in terms of the inclusive engagement of your employees. Now, for many of us, this is new, although we pay lip service to subjects like toolbox talks, risk assessments. We have a lot of fancy names for our risk management process at the ground level. Whether you're calling it a TSTI, DSTI, a last minute risk assessment, step back 5, you need to ensure that the workers understand, okay? So you need to have a tool in terms of measuring their understanding. And in cases where we had essential organizations still operating during the lockdowns, we found that we presumed or that into the message can. So for communications, measuring its effectiveness and including our workers. So next please, Fabian. Okay, so a very key area we should be asking ourselves now is, what's our readiness? What's our current readiness? So we've painted all the floors with social distancing markers. We've put up posters. We've trained people. We've got our screening areas ready. But are we actually ready from a mindset, or are we just looking at kicking off, starting production, focusing on productivity? So, and that's why we've put this picture in, because a lot of organizations are trying to balance the books now by returning to work. And we want a focus on, during this reflection session, to not just be on COVID though, also on your health and safety systems. A lot of the workers that we're working with now currently there's also a very, atmosphere of stress. And we'll deal with that later on when we go through the risk assessment section. And guys, it's very important that this gets discussed also at a very senior level in terms of readiness. If you're a health and safety professional and you're a leader, it's more now than ever that you have a voice. Okay, so if you're sitting in a boardroom, if you're sitting in a management meeting, it's now more than ever that you need your voice. If you guys are not ready, highlight where you're not ready and provide solutions. Okay, that's very important. Next, please, Fabian. Okay, so as I mentioned, a three target approach in terms of having a strategic approach is around principles, alignment, and your cascading stewardship structure. So these three elements are common in business, but normally left out entirely or partly by many organizations. And this we've developed from our experiences with organizations. For example, many organizations now are leaving COVID-19 up to the health and safety team. So they brought in either a consultant, they brought in a occupational health practitioner, a hygiene specialist, and these are the people that are actually dictating what happens. And the key word is dictating. It's wrong. Relationship, you're actually going to experience positive cases at a higher scale than normal. Without leadership engagement, workers will feel that they are not important. And as I mentioned, stress levels will be increased. And we can see recently at a number of organizations where these organizations, like our private medical facilities, the essential supermarkets that were open, were shut down. And one of the key learnings there was how engaged were the leadership. The other one was in terms of seeking to understand the mutual respect around and the collaboration amongst your teams. What does it look like post-COVID or even before COVID? And what does it look like now? What needs to be done to actually raise the bar in terms of seeking to understand what are the pressures, etc. On one of the presentations we did, there was an HR manager, during the talks, and they spoke largely in terms of this collaboration, getting workers involved in communicating in terms of stresses, remote work, etc. So it's important to engage your HR teams, engage if you're on projects, your project management teams, your schedulers, etc. More important, build on past learnings and experiences. So one of the questions we've been asked on this, okay, we've never had a pandemic. We have a new organization, etc. But you do have learnings, okay? Your learnings could be from training and communicating where you had gaps in. You could have issues around safety management systems or even systems compliance where you've had previous audits or gap assessments. Look at all these learnings and experiences and how is it related to its current to your current situation. Okay, so you've already got a tool to work with so you don't repeat these as well. A key part is also the alignment and team building. And for us, it's very important when we looking for alignment, to structure alignment. So a team building session, you could have a Zoom, you could have a Teams meeting, and still provide a structured team building approach. Because this was one of the questions. Hey, we're working remotely. How do you actually do a team building session? So there's so many new ways of using technology. You know, you could also put out a perception survey, 10 questions to your staff, get the perceptions, and then build your team building exercise on that. If you in a workshop environment or a factory environment, you could still do team building exercises while still practicing social distancing. Objectives and strategies. What are those now compared to when you had your objective strategy setting for the year? 2020 has changed. The direction has changed. Have you gone back to your objectives and strategies to actually align with the new norm? A key tool that we've shared, and it's working well with a few clients, is the 30, 60, 90-day look-ahead planning. Okay, so a lot of organizations have shifted. They've got a 20% workforce currently. And this, I would say, is our forward planning for 30 days. So for the month of June, we're at 20% workforce. We're at 50% compliance to the directive. We're not 100% yet. And for me, those are more realistic approaches. When I look at social media, and I'm dealing a lot also with schools and businesses as well, where guys are basically ticking the box saying that they are 100% ready. Please don't commit to being 100%. It's far better working at a realistic approach. Then build it up into your 60 days. So for example, in July, this is going to be our target. We want to be at least 80% in our workforce strength. And then by 90 days, we're tackling 100%. If you're working on this, it also allows to look at your KPIs, key performance indicators, at a more reasonable standing, and have a practical approach rather than just having a thing of ticking the box. Yes, we're ready. And if you look at our education department, if they use this approach, we wouldn't be in the current scenario we're in, where unions are fighting, kids can't go back, schools are not ready, etc. If, for example, other sectors used it, like mining, for instance, rather than bringing your workforce back to 100% and starting, but having the stepped approach, you would have seen a different COVID-19 program, okay? Or you would see a different results compared to what is happening now. The cascading stewardship structure, which is very important. I spoke about, you have health and safety committees. If you don't have a health and safety committee, you could call it a COVID-19 leadership team, where you've got one person assigned specific to looking at the COVID-19 program, the structure. Or you could incorporate it into your existing system, your health and safety committee. A key element here is around behavior-based also. So how are we looking at behaviors, the changes? If we have behavior-based safety models within our organization, and this came up about 3 weeks ago on 2 sites that we visited, the essential projects And when we looked at the behavior data, it was, which was positive. It focused largely on health and safety, unsafe acts, but there was no data around COVID-19. So social distancing, wearing of masks, the health and hygiene protocols, the last minute risk assessment discussions, etc. So we encourage you to look at these and also look at how people understand and communicate these out in terms of behaviors. One of the other elements that came up during our discussion with medical teams was the stress level, and we're going to be including it now. We're doing some work with two behavior psychologists in terms of adding a component around education, around stress, anxiety, etc. And you'll see it as part of our risk assessment review. Next, Fabian. Okay, so as I mentioned, and this is an extract from the International Labour Organization, two of the key areas here is the risk of infection. If you look at our first approach was to wear masks. We had this panic around coming into contact with people that are affected. We had this major push to have stuff cleaned, materials sanitized, and largely it is what is happening still now, you know. So we have social distancing. We also have the effective use of PPE, and how are we actually encouraging the use of this PPE. One of the challenges around the PPE side comes on the construction shop floors. If you have a factory, if you have, for example, working around machinery, what type of durations of people working with these masks? The advantage we had is that we had surgical masks being used. So on surgical masks, why I'm calling it an advantage, you'd actually be able to use it for, I would say, and this is what we've done, for at least 20 minutes, find an area that you are safe, actually have a breather and then put it back on. I discourage people using masks, and I know I come under fire for this, for long durations. Okay, so I'm currently reviewing now, especially in the Middle East, we have a heat season now that started. So what are the impacts with persons wearing your cloth masks for long durations? What are the impacts to their health, to their respiratory system? Okay, because your body is designed to get natural air. It's not designed to be covered. So these are challenging questions, and we'll be discussing later on in terms of the outcome. Ergonomics in terms of manual handling of loads, the awkward body postures, and I'm talking especially around industries where you have to wear stuff like Tyvek suits, you've got to wear additional gloves, you've got to wear face shields. So how have you built in your ergonomics review around this? And I've left the psychological side for last. And these are areas that came up under major discussion over the last 2 weeks, 3 weeks, in terms of fear of being infected, jobs insecurity. And I want to share with you guys, in Qatar, they've developed an app. So So the Eteras app, you're not allowed to travel or go in anywhere without this app. Can you guys see it? Let's put it here. All right. So this is what the app looks like. So for example, this is also, although it's good, it's created for me some panic in that, and I'm talking from experience. I hate to see this thing if it changes to yellow or red, right? But it's the new norm now. So how it works, if you come in contact with anybody, or if you are a potential COVID-19 case, this will change color. Then you go in for your testing, etc. And it's directly linked with the health ministry. So you can't jump out and say, hey, it's not working properly, etc. And now most organizations like supermarkets, banks, etc., if you're going in, you have to display that this is on green, okay? So I want you to just share in terms of how technology is also playing a major role in COVID-19. The isolation, the lack of social support, how are we gearing up our teams around isolation? And by the way, a lot of people are also looking at, for example, remote working. It is becoming an issue psychologically. How do you balance your times? It's new, it's a new method. How do I measure performance of staff working at social distance, working remotely? The increased workloads, and a lot of us have fallen prey to this, where we're working longer hours because we are more, I won't say comfortable, we're not governed by a 9 to 5 anymore. So a lot of us, if you worked in industry, you're actually a clock worker. So you punch your clock in, you punch out, that's your day. But a lot of us have seen an increase of mails coming at 3 o'clock in the morning, mails coming in at 11 o'clock at night, where people are still working. Okay, so we must also look at this, and I encourage teams to talk, and that's the purpose of the team building. What's your stress? What's your hours of work? So for example, traditionally, how many hours a day are you working? And as I mentioned, one HR specialist actually raised this in terms of productivity and how to measure productivity. Next, please, Fabian. Okay, so the last slide looks at workplace risk assessments. Yeah, so in terms of mapping your hazards, and before I go to mapping hazards, but by now you should have mapped out one of the key areas is who are potential risk cases for COVID. So we had templates in terms of if you're 50 and over, if you have a pre-existing condition, whether you're hypertensive, diabetic, etc. And this would be your first mapping exercise that you're actually going to be doing. And one is to look at putting these people to work remotely, looking at the actual activities that they need to do, and restructuring it with the help of HR, etc. So they mustn't be the victims. You must actually have a support structure for them. Mapping hazards and assessing risks. and this goes for your entire work area. So we had a walk down on 2 sites where we didn't even take into account our car park areas, typically. So those weren't considered our work site areas, where it should actually be. So your donning of PPE, your health and hygiene, your awareness process should start from that area. Your participative approach in risk assessments, as I mentioned earlier, now more than ever, you need to have more discussions around the table at your work fronts on your risk assessments. And a lot of us, when we hear risk assessments, we think of this massive document. Well, your risk assessment process should take into consideration your entire business. So if you have workers on the ground, what does your risk assessment process look like on the ground? And as I referenced a few examples, like toolbox, like DSTI, TSTI, etc. I'm not a fan of the word toolbox, so just for everyone. It's an old term, and it just references talking. It doesn't engage a two-way process. Using a planning guidance to reference risk levels. As I mentioned, the tool we used was 30, 60, 90 day, and we used it on projects. We still use it on projects, by the way. And it provides us a good proactive approach in terms of highlighting risks. Okay. The other area is your continuous monitoring. How do you measure your current controls? How effective are they? And we've seen this in organizations that have had positive cases. So, for example, you've pressed the go button, but you haven't had any opportunities of stepping back and saying, hey guys, we have an exposure at this area. We have an exposure at this area. Or more important, this process is actually working well. Why is it working well? And how can we enhance this on the other areas that are not working well? Okay. And lastly, any areas that you've introduced as new work processes or arrangements that have changed, it's important to have these risk assessed. As I started, it's a risk-based approach, and it's a system that doesn't require the stresses that have been put on it now. Okay, so if you have a robust occupational health and safety system, it's just going back to that system and doing some tweaks to ensure that you still maintain the health and safety of your workforce. That's it. Question time. Any questions?
Hi, everybody. Any questions, please? You can direct them through to Saide. No questions. Oh, Charlotte, I see Charlotte's hands up. Charlotte, you can go ahead. And next is Alec Peterson.
Okay, good morning, Mr. Saide.
Hi, Charlotte.
I wanted to ask, in the case of, let's say an employee is off sick, but I suspect that is one of the signs and symptoms. So when he comes back to work, what is the procedure that I'm supposed to take there? Am I supposed to request for a medical test results for COVID-19, or what do I do?
Well, firstly, the word suspect. So if you look at our reporting processes, I'm off sick. What was the reason for being off sick? If you look at the South African environment now, we're having winter, so at least 80% of these cases are going to be around colds, flus, etc. You'd still follow the protocol of screening. If you look at your screening covers a number of questions. It's flagged if the person has similar symptoms, then they'll go for testing. Okay.
Okay.
And this is the Department of Health has issued out these type of protocols. So the first one is screen. However, if a person has the symptoms, you'd actually, and it's important to work with your HR department. And you've raised a key point here. Your HR department should have already communicated this out to your teams. So before coming back to work, if any of you are displaying these symptoms, advise us before, and don't return back to work until you've actually got the green light from your doctor. So doctors are still working now. So you should be visiting your doctor. And I think more than ever now, it's important where a lot of people, if you look at current cases that we've had, people reported to work knowing fully well they were still ill. And this created massive impacts where companies were shut down. They had to re-screen people, they had to put additional protocols in place, etc. So you raised a very valuable point in terms of the importance of communicating to our teams. What you also don't want to have is a fear that if I'm off sick, I'm actually going to be labeled as a COVID-19 case. So if people are sick, encourage the process that you currently have. So for example, if I'm off, I contact my supervisor, I advise my supervisor I'm off, and I'd either get a medical note. If I'm off one day, depending on my organization, I don't need a medical note, or I still need to give a medical note. In terms of my feeling, how am I feeling? Talking about how you are feeling to your supervisor, okay? Whether it's stress, whether it's issues you're having, and this encourages a positive environment in an organization. But in a nutshell, if you are displaying the systems, report those, get yourself tested. But if you're off sick, you're allowed to report back to work once you're feeling better and be screened. I hope that answers you.
Okay, thank you so much.
Pleasure.
Thank you, Charlotte. Alex, you can go ahead.
Hi, good morning, Saide. How are you?
Good and you, buddy.
Fantastic, thanks. You actually answered my question when you responded to that young lady's question. You know, with this disease, because it's new, we don't really know too much about it. You got big organizations like the World Health Organization doing U-turns on statements that they've made publicly, and that causes a lot of confusion with companies or with the information that companies receive. Sometimes it's conflicting information, and it just causes one headache on top of another. Also, the issue of people's privacy being respected, especially workers who have AIDS and who are working, who are still employed with the HIV virus. This can have a negative impact on them, especially with regard to their status. They can be viewed as a carrier when it could be something else. You know, where do we draw the line? But you've actually answered my question with that we should just stick to what we know, or with the information that we've been given. And yeah, thank you.
No, yeah, but I think you've raised, thanks, Alex, you've raised two valuable points here. One is the amount of information, and I call it a information overload. And a lot of us are having flavor of the day type of scenarios. So it's important for any organization to step back, look at your current systems that you have, and what's necessary using the occupational to improve on that move from driven approach. My employees, if that mindset doesn't change, then you might as well close shop. All the money that you have, you've stockpiled, it's shown that you can have a pandemic of this nature where your money means nothing. You're also going to have to be isolated, etc. So the key message here is monitor and allow for changes almost overnight in terms of communication, but you should have a filtering system. That's the first part. The second area is around confidentiality of employees and their current medical status. So as I mentioned to you, we had this discussion with a number of organizations where part of this discussion was with HR experts. And we have a basic checklist where you complete. And when I share this, even with organizations, I highlight, don't send this back to me. Okay? So for example, when you're doing your first level screening of if you have people over the age of 50, people with existing conditions, etc., this is for your HR and the leadership team to look at. I can advise in terms of, for example, if you're a bus driver or a truck driver or a taxi driver, or based on your job, you know, what type of risk ranking you can add in when we're doing a facilitation of the assessment. But we need to also communicate to our employees that your current medical condition, which should have been known before, is not going to put your job into any jeopardy. And this must be a clear message for management. But two very valuable points you raised there. Thanks, Alex.
Thanks, Alex. Anybody else has a question? Please raise your hand.
Morning, Fabian and Mansur.
Hi, morning.
How are you guys?
We were
the other issue, Mansur, from my side is about the employers themselves. They have actually to explain it to their employees that if they are not feeling well, they should not come to work, and that will not make them lose the money for that particular day. It's a thing that many employees are actually afraid of, that I am not well, so if I don't go to work today, it means I won't be able to get my wage for the day. I think that's the other issue that I also would want you to add on as well. Thank you.
Thank you for the say. Now remember that based on the contracts that you've signed, and I want to make this quite clear, guys. If you're on a contract that has a no work, no pay policy, these are discussions you need to have with your management. Okay, and I'll stress this. it's come up as well in terms of contracts where, for example, a large percentage of our workforce work on a pay per day type of contract. It's important that the employer looks at it as well. However, those type of, we can't dictate right now saying, well, you have to pay these people if they're off. So if I'm ill and I have the common flu, etc., I would stay at home normally, right? Would I get paid? No, I wouldn't. Would I come to work with that cold flu? And in most cases, people have, and this is where you've seen some organizations falling prey to this COVID virus. And I don't want to mention names of these organizations, but it is a question being raised very often where you have, for example, employees that survive off that daily money. So it is a discussion that we need to have as well. How are they compensated? Have we re-looked at contracts, etc.? The other one is around contracts where you have sick leave. So if I don't come to work, I report as sick, I provide a sick note, and my sick leave days get deducted. So without COVID, if I'm going to be falling sick more often than normal, how has that impacted my sick leave cycle, etc.? So it's a good discussion that employer and employee should be having.
Okay, thank you, Said. Yeah, do we have any other questions or any polls on the topic? Okay. All right, so then I'd like to take this.
There's one from Vanessa from paperwork. I saw a question.
Sorry, I didn't see that. Sorry, Vanessa, please go ahead.
Vanessa needs to just unmute. I saw that she put a question on it popped up on the screen regarding paperwork.
Vanessa?
Hi.
Hi.
Said. Hello,
Hi, Vanessa.
Hi, Said.
With regards to paperwork, as you said earlier on, it shouldn't be like a book or something. And I've noticed with the client has given us a nice small contingency plan. But as far as us giving them paperwork, what is expected? Procedures, policies, risk assessments, anything else that we need to put in place?
Why do you need a policy on what?
Policies with regards to COVID. As you said, we must adjust our policies, our health and safety policy. We have to add COVID in there.
So why am I giving, sorry, let's just step back here. So just, you work in a construction environment or construction?
It's a civil construction.
Civil, right? Okay. And your client is asking for all these documents?
Mm-hmm. They want a contingency plan, inclusive as policies, procedures, risk assessment.
Okay, so but that's not, Sorry, I've interrupted. So carry on. I'll listen to you and then I'll respond.
I want to know from you with regards to now readiness for work. What do we need to have in place?
Okay. So firstly, a contingency plan is not the transfer of all your current documents.
Mm-hmm.
Okay. A contingency plan is, given your current scope of work, how are you going to actually ensure that you're going to execute and complete your work safely as possible? So many organizations now are falling prey to this overload and requesting a whole set of documents to be developed, which is, for me, it's wrong. A contingency plan covers, for example, on our sites, this is our project overview in a nutshell. We have work groups of a maximum of 4 areas. This is our tasks. These are our current risks, our exposures. Attached is our updated risk assessment. What's our strategy around communication? This is our communication plan. Done.
Yeah, no, I agree fully with you. So I just thought maybe I was just like overwhelming. I don't think we need to spin a Bible or a novel.
Yeah. No, but you've raised a valuable point here, because you know, there seems to be this rush now for rewriting the health and safety management systems.
Mm-hmm.
And we want to throw some caution here in that there should be a very simple approach, especially with agents, with consultants, with companies, to also understand the predicament of companies. So, for example, it's new, and I look at social media a lot. I follow a lot of groups, occupational health and safety groups, where people are actually coming out saying, hey, what should this document look like? And people are shooting them down, which is, it's actually not fair. So I'd be more than happy to work with you, or work with you all, whoever wants a draft of a contingency plan, and share that with your client. Your client has no right to object to it. They have to actually provide comments. If they have no comments, they cannot reject any document that you've issued on COVID-19. Nobody has a right. Contractually, I'll take them to the cleaners. And you can quote me on this. Nobody has a right to reject documents on COVID-19.
That'll be a good idea, Saide. Give us a tip.
Yes, please.
Please.
No problem.
Thank you so much.
And thank you for this. Thank you.
Okay, one more question before we close, if we may.
Hi, Fabian.
Hi, good day, go ahead.
Hi, it's Jay Naidu.
Hi, Jay, you can go ahead.
Good morning to the panel. In terms of Vanessa's question, if you look at your December holidays, you have a close of your project, and then you have an opening of your project.
Yeah.
Hello?
Hi, Jay.
So you take that document there and you add in your COVID-19, which means you'll add in orientation. So you'll do reinduction because it's your yearly medical is expired. So your COVID-19 will be covered in your medical, your yearly medical for your employees. So one, you have already covered now your medical there, your inductions are already covered with COVID-19 in it, and then your policy. You will now review your policy, your health policy, which now you will communicate in your induction. Then you will now review your risk assessments, which now you will carry into your health risk assessment, where you have your HIV, your malaria, your other diseases in your health policy. So add in COVID-19. So you're not reinventing. A lot of people are sending documents with 60, 70 pages. Now, the basic thing is for the man in the street. The man in the street needs to understand what you have written. So if you have 90 pages in a 1-hour induction, you cannot expect that man to understand 90 pages. So you got to make it simple. A 1-pager, your toolbox talks will cover your COVID-19 and your posters. Those are the things that I think the Department of Labor needs to, would like to see. What have you have done to protect your employees? What is the awareness? Your traffic plan, your security policy will change. So now you have a safety officer that's doing safety and health, which means in some companies, they're more than 500. So you will have to employ more people in terms of registered people to do just your health part of it. If something happens, you have one safety officer for 500 people. That safety officer is under pressure. He won't cover your health portion of it. Your random checking, take your alcohol policy, convert it into your COVID-19, change the wording of it. So you have short policies and use words that the man in the street can understand. Don't use long stretching words for the boardroom. The boardroom people understand those long stretching words. I'm not putting anybody down, but what I'm trying to say is the man in the street needs to understand the basic stuff. If he does the basic stuff, we will combat this virus. And he needs to take this back home. So which means you need to do a policy, a toolbox talks on COVID-19 that he needs to take back to his family as well. The other thing is, if the person clocks in, he's automatically on duty, which means he will fall in. If he's positive, his reading is 38 above, then he's on duty, which means you'll have to fill out your WCL form. At the bottom of your WCL2 form, it states, was it work-related or not? Where you sign off as maybe the supervisor or the safety officer or manager. So let's look at that as well. Thank you.
Jay, thank you for this. But you raised a number of topics, which I know time is against us. I just want to talk on medicals, screening, and testing. So a key question I have, why do I need medicals?
The one is your medical is your yearly medical, your pre-medical and your post-medical.
Okay, so just for everybody, So just for everybody, I don't need medicals to get back to work now, as I come back from COVID.
No,
which I'd like to clear up. No, I'd like to clear up. I don't need medicals. Okay. Secondly, if I have 500 people on a site and I only have one safety officer, I'm in contravention. So I should have the number of safety officers that are required as per law. I should have a health and safety committee structure, okay? And I should have health and safety reps. Correct?
Correct.
No, I'm just, because you raised a lot of areas. Also, if I have a health and safety policy, I don't need to label it as a COVID policy. It's my health and safety policy. I don't label it as a COVID policy. Nobody is talking of a COVID policy. We are talking about incorporating into your current existing system, how are you tackling the COVID-19 pandemic? So if you have a robust health risk assessment on your site, you'll tweak it. If you don't, you'll incorporate it into your project risk assessment or your company risk assessment. Okay. I just wanted to make clear, because we have a lot of people that are listening, and they don't take it that when I'm going back to work now, one, we'll need medical screening, we'll need medicals to be done. Secondly, we need to change the wording of our documents. No, my existing systems will be utilized and I will be sharing. These existing systems is the framework, whether I'm ISO 9000 or have an integrated management system. These are the integrated management systems that I've put forward in my contract. Okay, which is very, very important. In terms of communicating to the workers, we need now more than ever to put in a knowledge retention process. Okay, we must be careful, and I strongly support you in terms of not having an overload. So I won't call it an induction program, because an induction program already stresses that you should be sitting people down for almost a day session, right? So all you're going to be doing is re-emphasizing the COVID. It could be done in 1 or 2 slides, but you need a method of testing whether these people understood, especially around your supervisors, those that are in lead positions. Those are the key people that we should be targeting, okay? And then finally, and I must compliment you for all those points that you raised. In terms of communicating COVID-19, the World Health Organization, our Department of Health, have prepared tons of documents, posters, pamphlets in various languages. Let's make use of what we currently have. So as organizations, talk to the Department of Health, get the Department of Labor engaged. Any free material that's ready available, get that material. And making sure that the employee understands it, they're taking this material home to their workers, to their families. If they are staying in environments like labor camps, if they are staying in environments such as hostels, how is this being communicated at those levels? And that is the job of the Ministry of Health or Department of Health and the Department of Labor. Sorry, thank you.
Thanks a lot, Sir Said. Yeah, and you made another valid point as well. That's one of the big areas that we're struggling with here with the labor camps, the dormitories here in India. And it's obviously been a big challenge in Singapore as well. Singapore at the moment, just for information's sake, you need to do a PCR test before you mobilize the employees back to site. So each person will be tested, not screened, but also PCR swab test conducted, lab analysis done, and results given prior to those people being mobilized to site. So that's the stance from the Singaporean government with regards to management of the COVID situation. So yeah, thank you very much. I think it was a very, very good, informative session. I enjoyed the discussions as well. So thank you, everybody, and have a good day. Thank you, Said, for your time and for
Thank you.
excellent
Thanks to
presentation.
everyone.
Thanks a lot. Take care. Bye.
Thank you. Cheers. Bye.
Bye.